Yeah, and you got great skin, and of course you're a dermatologist.
So I keep things very simple. I think fundamentally I'm really a minimalist when it comes to self-care and skincare.
I'm 41 this year, so I want to know, should I, like, what is the skincare routine for someone who's like, edging to middle age?
Right.
Should I, like, step it up with the skincare, or what should I do to maintain, looking fresh and not looking dull?
So I think that you're doing a great job because the skin is good as it is, right? So I think it's more important to know your skin type. So typically, I mean, like people have talk about whether you have like oily skin, you have dry skin, combination skin. So that's quite essential. I think it's important always to have good skin hydration. I think that's like everybody can do with that, right? Yeah. So like the oily skin type patients will do well with more hydration because it rebalances the skin and it's less oily. People who've got dry skin type can always do with more hydration. So hydration is always like a key point. Yeah.
Once your skin is hydrated, then you have less of these all other problems.
Absolutely. You get less reactive skin, you get less sensitive red skin issues like eczema or like maybe sort of flaky skin. Even things like rosacea as well, which happens in the 30s to 40s.
What's rosacea?
Rosacea is a form of like type of like acne, like related to that, where you get bumps around the mid part of your face, around the nose, around the chin.
Like small bumps?
Small bumps that are headless acne. It's sort of and then the skin tends to flush quite easily as well. So
what should one do when you get that?
When you have like rosacea, you have to be very careful with the skincare that you use because typically skin is very sensitive and reactive. They don't tolerate most things well. So usually everything they try, the skin just gets redder, the skin gets more irritated as well. So rosacea skin types typically do well if you hydrate the skin well as well, because it does help to also soothe the skin, makes it less inflamed. So generally, I think hydration is always a key thing to address.
Okay, so hydration. What about fine lines and and as you age, like gravity take over and like droopy skin and all that.
Exactly. So that's all age-related changes.
So does that help? Like all those like lifting cream and in the market?
I honestly don't believe in lifting creams. Like I really think creams have very little effect in lifting the skin. Like I really think you really need lifting, right? Then you probably need some help from either the form
aesthetic
of
way,
an energy-based device, something that is like be ultrasound treatment with the radio frequency technology to sort of like tighten the collagen and stimulate that to reform, and then overall sort of lift as a global platform improvement. Or you might require some hyaluronic acid injections to sort of volumize certain areas, because it may be sagging because there's volume loss. It could be because like the fat pockets sort of like shrink over time, the skin is stretched up, and then you start to see lines appear because there's deflation, right? Like a balloon loses air. So you might not need some re-inflation of that from that standpoint. So that, I think no amount of lifting cream is going to work. So I think creams are better off in the hydration standpoint. Good for hydration. We're using it for like pigment issues, great for that perspective as well. Also good for maybe fine lines to some extent.
Fine lines,
depends
because
on what you
of hydration again, right? If
one is hydration, one is like really fine lines, like wrinkle type skin.
So
retinoid class. So patients sometimes pick up an anti-aging cream, usually contains either peptides or retinol. I lean away from moisturizers with retinol for one reason, largely because you can't really titrate that. So retinols tend to be a little bit irritating on the skin or a bit drying. Moisturizers are meant to be moisturizing.
Okay, so I also hear that probiotics can help with skin. Is that true?
To some extent, yes. I think that is really the buzzword that's all the vogue now. So it's been a few years coming. So we see probiotics in the form of like oral supplements. We see probiotics in the form of like skincare as well. So there is like there are probiotic skin
for your skin.
For your skin. So skincare or moisturizing creams that incorporate healthy bacteria. So that's been trending for a while now to see an increase in the number of like skincare brands that would utilize that.
Yes.
And we also have sort of like been using probiotics in the treatment of like eczema, for example. That can be in the form of an oral probiotic, and it's really sort of the belief system that having a healthy microbiome is essential. If you have a healthy,
that means a balance of good and bad bacteria on your skin.
That's right.
So if I'm not using any skincare with probiotics on it, I'm just taking it orally. Would that help your skin as well?
that should. It's sort of like the concept that, if you rebalance your gut and there's less inflammation, it also then sets off less inflammatory response as well. So overall then, things are inflammatory in nature, things like eczema, for example, and inflammatory skin conditions should modulate as well and get better. So there's the belief in that. And there's also the belief in populating the skin with healthy bacteria by using the right creams to rebalance the skin.
Yeah, you are a wealth of knowledge. So for audience who might want to ask you more questions, they can find you at...
They can follow me on my social media pages at Angeline on Dermatology on Facebook, Instagram, and YouTube. Or they can go to my website here.
Yeah, here's the website if you want to know more about what Dr. Angeline does. And if you have more questions, you can actually just leave it down below in the comment section. Thank you for watching.
Thank you.
Bye.
Bye.